class now. We'll do 1 hour from now. Okay, so this is OET speaking. Guys, we're going to review. This week is just 1 week on introductions. Okay, next week we'll move on to different topics, but every day this week we're just practicing how to introduce yourself. Today I want to focus on this because I know it worries a lot of you, starting in the middle. Okay, so in this class what we can do is we need to review, because every day we should review. Okay, so we'll start off with a review, but every day this week we'll start off with a review. Then we will go and look at this idea that you can start in the middle of a dialogue sometimes. At the end of the class, I'm going to get some example cards, and I want you guys to give examples, people who feel confident. So Angela, if you want to try it, if you can, or Teodora, anyone who feels like trying an example card, after we talked about it, you guys can speak and I'll give you my opinion. Okay, so let's get started with this review. Can I speak to, please, Fatima? Could you say hello? Introducing yourself.
Hello.
Fatima, do you remember we said, Fatima, that you have unknown patients and what?
I can introduce myself.
If I'm going to introduce myself, sometimes the patient will be unknown, right? I don't know his name. What's the opposite of that?
Opposite is I missed the last 2 classes, honestly.
It's okay. If
do
you think that sometimes you might know the patient as well in OET? Is it possible to have a known patient? It is, right? It just means that I know the name, right? And I'm going to start like that. So if we're in a hospital or we are in a clinic, Elif, how do we start if I don't know the patient? I'm in a hospital or a clinic. How do I start?
We should greet and introduce ourselves.
And?
Name, yes, and our profession.
Profession, good. Can you give us an example?
Hello, my name is Elif. I am one of the dietitians in this hospital.
There we go. So we've been practicing this for 3 days. That's really nice. Hussein, Giassi, what do I do next? Check
their name.
Yeah, give us an example, Hussein. How do I check the patient name?
Can I confirm your full name?
Or just Hussein, please, and then Giassi, you can do it as well. Go on. Can I
confirm your full name, please?
Alan Wenham.
How may I address you?
You can call me Alan.
Great, Alan.
Okay, was that correct, guys? What do we all think? Was that correct here?
Yes.
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 Okay. Yeah. What do I do next? Teodora, Giassi, next I'm doing what? What did we talk about? Monday, Tuesday, Wednesday?
Empathy.
Empathy question.
Yeah.
So Giassi, give us an example of an empathy question.
How are you feeling at the moment?
And I say, oh, I'm feeling really bad.
Oh, I'm sorry to hear that.
Okay, so in my opinion, to be honest, I really feel this very strongly. Don't ask just an open question. In my opinion, ask a question about feelings. That way you can immediately start giving empathy. Okay, what's another thing that we can put in here? Does anyone remember? One more?
Context.
Context. So Zuhal, give me an example of context.
For example, I'm aware that you had a fall in the previous, so how are you feeling at the moment?
There we go. Okay. Now, guys, we studied this on Monday and Tuesday and Wednesday. In the chat, you can see the diagram, okay? So I made a much more detailed diagram previously. Today, it's just very simple. Okay, that's if I know the patient. Guys, like this. Hello, my name's Alan, and I'm one of the nurses in this hospital. Can I confirm your name, please? Okay, and may I call you Jenny? Fantastic. I'm aware that you're having problems with your medication. So how are you feeling at the moment? Oh, I'm sorry to hear that. Okay, so that's your unknown hospital or clinic introduction. What if I know them? Janet, what am I doing if I know them already? I have the name. from the start? Dana's not able to speak. Grace, Lee, could you help us out? Angela, Mubin?
Yeah, so we'll say, hi, Alan, nice to see you again.
Yeah, plus something nice. Hi, Alan, nice to see you again. And then what else?
And after we'll remind our name and job. Just to remind you, my name is Angela. I am one of the nurses in this GP or hospital clinic.
Excellent. And this one, do we have to do this one, Angela? Is it optional or?
I think it's good to remind the name and the job, in my
Yeah.
opinion.
I really like it, but I think strictly speaking, guys, if you didn't do it, is it a problem if we don't do it?
Optional.
I think
Not
no,
really.
right? But it does sound really good. I recommend doing it, okay? It's the same here, guys, with context. It's optional. You don't need to give context, but it's a good thing. What's next, Angela?
Empathy questions. How are you feeling at the moment?
Empathy question. So how are you feeling at the moment? And I say, I'm feeling really good today. The medication is working very well.
I'm glad to hear that.
Okay. Can I give context if I know them?
Yes, you can.
Give us an example.
Amanda told me yesterday because I did a mistake. I said you are here to check your blood pressure. Amanda, what was the correct one?
Amanda's here. I didn't
I've-
notice.
I've just appeared.
Amanda, how you doing?
Entered. I'm tired, actually, but well, thank you.
Oh, you're in Australia at the moment, right?
Yeah. And I went out on
it's-
a bushwalk in the extreme heat.
Oh, wow. You know,
Yeah.
from living where I'm living now, I'm really starting to realize what extreme heat is like. I think unless you live in a
Yeah.
hot country, you don't realize. Okay,
Oh, no.
guys, this is Amanda of Messy Tea. Sorry,
Hello,
Amanda.
Amanda.
Hi, guys.
Amanda is our basically one-to-one tutor. So she comes into the speaking just to say hi. And basically, I want to just mention, guys, if you want to do some one-to-one with Amanda, she is really, really good. So if you feel that you just need some practice with a native, not a class, but rather one-to-one sessions, guys, just check this out here. I'll put this in the chat, okay? Oops, this is the wrong one. And she has really, really good reviews. I don't know, Amanda, what do you want to say about this? Am I embarrassing you?
No. You're just charming me. I love it.
I'm selling you.
Flattery. Flattery will get you everywhere. Sell me. Yeah, no, it'll be a pleasure to work with everyone. I love having chats with everyone. I think everyone knows that too.
Who's worked with Amanda here? Anyone? Feel really confident, okay?
Yeah, me.
Yeah,
Good.
And
hi.
Oh, Amanda, you know
Hi,
Zilha?
Amanda.
Ah, there we go. Okay. So guys, look.
Yeah, we had some classes.
How were they?
It was very nice. And Amanda's quite, I can say, is amazing and lovely.
Oh. So Zuhal, I'll pay you the money later, all right? But thank you for that. No, guys, she's really good. It's in the chat. If you need extra, then go and check this out. We're not studying, speaking is strange, isn't it? If you're going to speak, you shouldn't really think too much about what you're doing. The best way to get better at speaking is practicing every day. But if you want to pass OET, you do need to know something about what they want. Okay, so these classes that I'm doing, it's about giving OET what they want. Like, what are they looking for? I'll teach you. But if you just need to practice speaking with someone, Amanda's a really good person to try. Okay, now we're reviewing the unknown and known introductions, but this is just hospital and clinic. So, Yevgeny, what's the other situation that we have? Mariam.
Yeah, it can be home visit as well.
So tell us, Yevgeny, what am I doing in a home visit?
In our home visit, we need to introduce ourselves.
Introduce self. Yep.
Yeah, for instance, we can say, hello, my name is Evgeny. I'm one of the doctors from your local practice.
So greeting plus name plus profession.
Yeah.
Yeah. Then what's next?
Confirm name.
Okay, so check the name or
That's the
confirm the name.
name.
Yeah.
Yeah. And say thank you for inviting me into your home.
Why do we need to say that?
Because we are in their home. It's polite.
Exactly. Guys, you're in the house. Tell them why you're there. I think it's more important in a home visit. You can say thank you in a clinic. Thank you for coming in today. You can't say thank you in a hospital. These things are optional, but in a home visit, I think it's a good idea to tell them the reason for the visit. Okay. Yevgeny, what's next?
The reason why we are here, what we are going to discuss.
Exactly. Sorry, yeah, the reason and thank you. Yeah, go on.
Yeah, that's it, context and how are you feeling today? Yeah.
So from the very beginning, Yevgeny, I'm your patient. You don't know me. You're in my home. 3, 2, 1, go.
Hello, my name is Evgeny. I'm one of the doctors from your local practice. May I confirm your full name, please?
Yes, it's Alan Wenham.
Thank you. How may I address you?
You can call me Alan.
Okay, thank you, Alan. So thank you for inviting me into your home. I'm here to discuss your recent test results. Is that okay?
That's fine.
All right. So how are you feeling at the moment?
Oh, I'm feeling a little bit stressed about them, to be honest.
Oh, that's quite understandable.
Okay, so I'll stop there. What do we think of that, guys? Did Yevgeny do a good version? Was there any mistakes with?
Yes.
Who said yes?
Yes, mistakes.
That's me.
Yevgeny, I thought it was really good actually. But Mariam, did you hear anything?
Yeah, I said it's very good.
No, thank you.
It's very good. Small thing. Why did you say you gave context and then you asked me a question? Did anyone notice? He said, I'm here today to, and then he said, like, is that right? Does anyone hear that question? That right?
I ask it, is that
Is that okay?
Is that okay?
No.
It's just my opinion, okay? So it's very subjective, Yevgeny, but I don't think it works as well. Guys, don't stop between context and empathy. Just go straight through, okay?
Do we need to check if the patient is like, okay, so we can continue?
I think no, because what do you gain from it?
I need the consent that the patient is okay to continue with the next wherever step is. Like, I need the confirmation. We normally ask, is that okay? Like, you are here to do a blood test, is that okay? So we normally ask the consent.
So what if they say no?
If they say no, I wouldn't do anything because we need the consent.
So you can't do the test then?
No, there is the consent. Patient's consent is really important in everyday life.
So I guess so. If you want, it's fine. For me, this is an OET test, right?
Yeah.
They're not going to say no, right? And it sounds...
Do we lose points, like, because we are normally used to do like that? Do we lose any points by confirming, is that okay?
I don't think so. What do you think, Amanda? There's nothing in the criteria saying that you have to check it's okay to have the consultation. Nothing explicit. What do you think, Amanda?
You don't have to. You don't have to at all. But I understand why Angela is saying it because of the situation she was in, because she's working as a doctor. So I understand that. But if you ask consent, that's fine too. You're not going to get into trouble for it. You're not going to lose points. Definitely not.
So,
okay.
Look, it doesn't really matter this. This is a language test, not a real thing. The reason why I'm saying go fast is because you can get like you want to show them that you have really good fluency. Sometimes people do this, guys. They say, hello, and they wait here. Again, why? Why wait? Do the whole thing really fast, and it sounds really professional. I'll give you an example. Listen to me, guys. 3, 2, 1. Hello, my name's Alan. I'm one of the doctors in this clinic. Can I just confirm your name, please? Okay, fantastic. Oh, so I said clinic, didn't I? Start again. 3, 2, 1, go. Hello, my name's Alan. I'm one of the doctors from your local clinic. Can I just confirm your name, please? Okay, great. May I call you John? Fantastic. So thank you for inviting me into your home, John. I'm aware that you're having problems with your medication. So how are you feeling today? I just think, in my opinion, that just going straight through makes you sound really confident. If you want to break it up with question, is that right? Fine. It doesn't matter. Let's not talk about it anymore. Okay. What if we know the patient? Rajwant, what am I doing in this situation? Monica, Fumi, I know the patient. I saw them recently. What am I saying? The diagram is in the chat, guys, if anyone needs any help. Yes, go on.
Good to see you again, or just
I can use the name, yeah?
yeah, yeah, Alan. Yeah.
So,
To
hi,
speak
Alan.
to Aria or something.
Okay, what's next? Gloria, could you tell me? Favor, Doigu, what's next? We can do the patient name. Hi, Alan. Nice to see you again. What's next?
Just to remind our name and job.
Is it essential to do this or just optional? Everyone, essential or optional?
Optional.
We can choose to do it. You can do it if you want or not. Do I need to say thank you, guys?
Yeah. Yeah.
Yes. Okay. Do I need to give context?
Yes.
Yeah.
Is it optional or essential?
Essential because
Essential.
Yeah, well, we need to, I think, here probably because, I mean, what? Tell them why you came into their house. Finally, do I need an empathy question, guys?
Yeah.
Okay. So this is a review of what we've been studying this week. This week we've looked at introducing yourself. I made a diagram showing this. It's in the chat. Okay, so if anyone wants to see the diagram, it's in the chat. We studied this already. I was just wondering if you guys could remember it. This is the diagram I made from Monday. Okay. Now, today, I don't know, does anyone have any questions about this? We talked about it many times. Does anyone have any doubts or questions? This is from Monday. Okay, good. Because you know what we haven't really spoken about, not really, is starting in the middle. Okay, so what's the difference between starting in the middle and known patient? Janet, Ayadola, what's the difference between a known patient and starting in the middle? It's a very different.
I think the known patient may be that you know the patient, but may not be that you have done any test or examination. But in case of starting in the middle, that means maybe you have done something for the patient. That is the cue card says that you have examined the person and you just want to give the feedback or what your examination result is.
Excellent. Does that make sense, guys, what she said? I think that's a brilliant answer. Is that clear?
Yeah.
Yes.
You have done something already. Yes. Right? Whereas a known patient, it might be that you saw them very recently, right? That's it. If the patient, you saw them yesterday, don't give your name again. Just say, if you saw them yesterday, right? You just say, hello, Janet. Just to remind you, my name's Alan. I'm one of the nurses in this clinic. I'm aware you're having problems with headaches at the moment. So how are you feeling right now? Okay. But if you already did something, if you've done something, what do we say in this situation? Nasikat, Neslihan, Oscar.
Yeah, and can you ask again? Sorry, I missed the question.
If I have already done something, does that make sense to you?
Yeah,
Do you want to see an example? Guys, do you want to see an example of this? Okay. Does everyone see this here?
Yes.
Okay, so Fumi, do you see the word just? You see the word just.
Yes. You have just explained examined, yeah, the knee. Yeah.
What does it mean when you say just examined?
Just examine is almost done now. Just finished. So that it's happening now.
Is it happening
now?
or guys, I
Just finished.
Just finished.
So it's like finished very recently, like maybe 1 minute ago or 2 minutes ago. Okay. Guys, I just ate. When did I eat? 1 minute ago, right? Just now. Okay. So this is what she's saying, guys. I already did something. You see what I mean? So should I be like this? Hello, my name's Alan, and I'm one of the physiotherapists in this clinic.
No.
No.
All right, you're in the middle of the dialogue. So there's no names required. There's no names. So what should I do? Mubin, I already started. We're in the middle of the dialogue. I've done something already. How should I introduce myself? Mubin, Shanice, what should I say? What's the solution?
I can say thank you for letting me examine you, then start the card.
So you can do the thank you
Thank you for letting me examine you, and then start.
And I'd be interesting, Amanda, what's your view on this? You can do the thank you, or I can think of one other way. Do you have any things that you give in when you're
Or
doing...
I can say I have just finished examining you.
I appreciate it.
This is for Amanda now, guys. Sorry, I'm not controlling things very well today. Amanda, what's your view on this?
Yeah, it's just easy to say, thank you for letting me examine you, blah, 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 blah. That's the standard one, isn't it?
This is a good one. I really like this one. Is there another way to do it as well, though?
We can say, okay, I finished examining your knee, and now I would like to blah, blah, blah.
They just finished. Yeah. I've just finished blank plus start. Honestly, I'm genuinely interested. I don't talk about this very often in the classes. Does anyone have any ideas of things we can do? These two, very good. Anything else? Any other way? I don't think there's any other way.
What about appreciated?
Fatima, go on.
What about appreciated? Like, I appreciated you letting me finish the examination.
Probably
or...
a bit too much, really.
I appreciate you. Yeah. What do you think, Amanda? Too much? I appreciate you letting me.
That's too much. It's
Maybe
very
too
nice, but I probably wouldn't say it in OET. Unless the patient's been really difficult. No, you can't examine. No, 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 no. And then they let you, and then you can say it. But
it's too. I think she's right, guys. It's a bit too polite. It's too much politeness.
Yeah.
You
we
might
are very
think,
polite in the UK, but not that polite.
I was going to say, yeah. You might think, is it possible to be too polite in English?
Yeah.
Yes, very much so it is. Camilla, go on. Question?
Yeah, I was thinking like to say, like I can see that you're very sore. I'm sorry for that. Like showing empathy. Can I say that?
You need to sort of. This is basically context, guys. This is basically context, and I don't think that gives enough of an idea of what has just happened. Right?
Okay.
So thank you for letting me.
Keep it easy.
Yeah, I would be these two. Okay. Ayadola, though, let's see if she's got any.
Yes, the question I have, can we say from the examination I've just done, I noticed blah, blah, blah.
That's a possible
one. Okay, actually, isn't it? That sounds all right.
So you put some fillers in, though, Ayadola. So you could say, okay, so from the examination I have just done.
I like that.
I noticed that there's a lump in your breast or something like that.
Yeah, just depend. Everything depends on what the cue card says, right? So here's 3 ways you can do. I don't think you need to do all of them. Choose 1 or 2 that you like and write it down, guys, because we're going to practice this now. Okay. And I think one of the best ways to learn anything is just to see examples. So we're going to have examples of this now. And if you guys want to try as well, let me know in this class. Can I show you all a cue card? We're going to do a cue card and we're going to listen to examples of starting in the middle. You guys all ready?
Yes.
One person. Now,
Yes.
are we all nurses and doctors here, or do we have some pharmacists and dentists and other professions?
I saw Shanice in there somewhere, I think.
Exactly. And we've got Ukor and Zuhal. So there's not just nurses and doctors here. So my solution for this, guys, is I made a very generic card here. What does that mean, generic? Patients? Yevgeny? Hussein? What does generic mean?
All professions.
Common to all professions.
It can work for all professions. What does the word generic mean exactly? You two. What is it? Can you give me a
Very common, usual.
Very usual, very general, I guess. Very general. Okay, guys, this is hopefully can work for all professions. Look, medical professional, that's you. Your patient has come to see you. Could be a pharmacist, could be a dentist. You have just finished blank. And you now need to explain some next steps. Okay? So we're going to have some examples of this, but whoever it is needs to think what it will be. So I want to start actually with Jassy. Jassy, could you say hello? Because you're normally quite good with this.
Okay. Hello. Hello.
She's a nurse, guys. So can anyone give us an example of something she just finished doing? What has she just finished doing?
Finished checking the blood pressure, and the blood pressure was high, so she needs to give some advice.
So BP, okay? And Jassy, I'm going to be really nice because lots of people will be watching you. You've got the language here, okay?
Okay.
So guys, this shouldn't be really hard. It should be actually maybe one of the easiest introductions in OET, okay? So let's listen to Jassy. I'm the patient. She just needs to start in the middle of the dialogue. She's not going to introduce herself. No names are required, okay? Now, Jassy, shall I give you a few seconds to get ready?
It's okay. I can start.
Okay, guys, everyone listen to this and let's see if this sounds natural and correct. 3, 2, 1, go.
Thanks for your cooperation. I have checked your blood pressure. I noticed that it's a little bit low. How are you feeling at the moment?
Okay, so we'll stop there. Stop there. Okay. So, what do we think of this? Put your hands up. Was that okay? Did she start the card properly? Angela, what do you think of that one?
I would say she maybe need to say thank you for letting me do your blood pressure. Or
yeah, the language. Amanda, did she paraphrased it actually? Do you think that was okay language, Amanda? I didn't think.
I thought it was interesting because it's again it may be like you said, no, Alan, I'm not going to have this done, and then eventually you cooperated. So if you think about it that way, it was okay, but maybe it's just more straightforward. Thank you for letting me take your blood pressure.
Okay, she did her own paraphrase, so maybe I'm going to listen again.
Yeah,
but it was nothing terrible. Jassy, though, did she explain anything? Did she actually start the card?
Not yet, I think.
She asked a question, right? She went. So that's because Jassy, we normally practice, don't we? Starting with open questions, right? She's doing what basically I've taught her to do, which is to start by asking open questions. Now, is she starting with open questions here? No. Okay.
No, she need to give the results in this case, maybe explain her findings.
So it just depends. Yeah, exactly. Jassy, it might say find out about, very often they say something like that with a start in the middle. So in that case, what you did is correct. But here, she needs to begin the explanation. So what does she need to say? Can we help her? She's going to do it again. What can she say? Should she ask a question or not? She could ask a question to
Yes,
start.
yes, she could ask a question about the activities of the person
Well,
daily.
she wants to signpost the start of the explanation, doesn't she? How do I signpost to the start of explaining? V1.
Maybe
Oh, let me
She
explain
can say, I would
blood
like to talk
pressure.
about your symptoms or
Yeah.
something.
So I'll just explain, blah, blah, blah. Is that okay? All right. So here I think this is called, I call this permission question. So here you could have, here's a place where I do like the permission question. She could do it here. So guys, I'm going to give an example and then Jassie's going to try again and then we'll try some other people. Okay. So listen to this. Hope this goes well. Jassie, can you be my patient?
Yes, please.
Guys, listen to this. 3, 2, 1, go. Okay, so I've just finished taking your blood pressure. And now I'm going to give you an explanation. Is that okay?
Yes, please.
Okay, so your blood pressure is high and blah, 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 blah. What do we think of that? Amanda, what did you think?
Perfect. Perfecto, mi amore.
It was okay, wasn't it? There was something wrong, felt wrong. But basically, I think this is good enough. Okay, so Jassie,
It's definitely good enough.
You try something like this, and then we can even try something with Amanda, who can probably do this better than me. Okay, so Jassie, you try now. Ready? Guys, listen to this. 3, 2, 1, go.
Thanks for letting me examine your blood pressure. I noticed that your blood pressure is a little bit low. Let me explain the situation. Is that okay?
Yes, that's fine. You can say blah, blah, blah now.
Oh, blah, blah, blah.
What does blah, blah, blah mean? Anyone?
What's the
symptom?
Next step to do.
I suppose it means
situation?
etc. or something like that. Yeah, it's very informal. Okay. All right. So I thought that was very good. Did anyone hear any issues with that? I thought that was actually pretty good.
I did hear examine your blood pressure. I think I heard that.
Brilliant.
Rather than take.
Instead of
but-
taking blood pressure, she said that.
I checked.
Ah, right, okay.
Just check.
So maybe there was a small language issue there. In general, the flow was good. Amanda, do you want to try this for us as well? I'll be the patient.
Oh my gosh.
You don't really
Put me
need
on
me.
put me on the spot, why don't you? As we say. Okay, I'll just do the basic. Okay, Alan, thank you for letting me examine your tongue. So before I continue, do you have any questions?
No, I'm fine, thanks.
Okay, so unfortunately, I can see some white spots on your tongue. However, try not to worry because I can give you some antibiotics. Is that okay?
Yes. Okay, so Amanda did something different here, which I really like. What did she do? She didn't ask permission question. She asked...
Is that okay?
Now.
She said before I continue as well. What would that be before I continue?
Do you have any questions?
Signpost. No, it's a signposting phrase before I continue. So she's telling me something is coming, right? Signpost. Do you have any questions?
May I ask about unfortunately? Is that really appropriate in speaking? Unfortunately.
What do you? Yeah.
I mean, if I say unfortunately, you have appendicitis.
I think it's fine. But how did she say it again? Amanda, do you remember what you said? Unfortunately.
I did say
Yeah,
that.
you have a white spots. That was my question. Is it okay?
Wait a second, guys. Look, in speaking, you're allowed to be more informal than the writing. The grammar. One crazy thing as well people don't realize is speaking has a different grammar to writing as well. Right? There's no commas in speaking. And you shouldn't. Should you say cannot or can't? Which one?
Can't.
Can't. Why? It's more informal. It just sounds more friendly, guys. It sounds way more friendly to say can't than to say you cannot. You sound like a robot. So in the same way, I think phrases like unfortunately, it's just a sort of, there's nothing rude about that.
And yeah, I do know what you mean though, because I might be giving some bad news, but unfortunately I found some white spots on your tongue. However, I can give you some antibiotics. So at least I gave him some positivity.
Yeah, Okay, so
I don't
Yevgeny,
know.
we're jumping on you here, but thanks for that comment. That was a really, like, guys, listen to what we're saying. We're native speakers. We're going to say things without realizing it, and you can ask a question. Why did you say it like that? Okay. All right. So we have Jessie, me, Amanda. Who else would like to try this? Put your hands up. Camilla, you want to try?
Yes,
So,
yes, please.
now she's a doctor, guys, so it could be BP, or could we change this?
Putting a cast, is that okay?
So cast. Okay, she's just done a cast. Okay, 3, 2, 1. Start when you feel ready. I'll be the patient.
Okay, Alan, so I just finished putting the cast on your wrist. Before I continue, do you have any question?
No, I'm fine, thanks.
All right, so I just put the cast because that will help to align a little bit your fracture. And I can ensure that the pain will improve a little bit while we find a theater room to make the operation. Is that okay?
Yeah, that's fine. Okay, we'll stop there. How did that sound, guys? She used Amanda's phrase. To me, sounded very nice. What did you all think? Anyone heard any errors there? I think there's quiet because there was very few things wrong with that, Camilla. That was very nice. Were you happy with it yourself, Camilla?
I think that is too, like in 5 minutes. I don't know what else to say. What can I say?
No, this is
no. Don't need to say anything else. It was perfect.
It was really good. It was really good. Okay, we'll try someone else. Hussein with an E. 3, 2, 1. Start when you feel ready, Hussein. You're a doctor as well, yeah? So cast. Hussein?
Yeah. I'm ready now.
3, 2, 1, go.
Thank you for letting me examine you. Before we proceed, do you have any question for me?
No, not really.
We have just finished checking your blood pressure. Unfortunately, your blood pressure is a little bit higher, so we can do a lot of things to keep your blood pressure normal. So is that okay?
That's fine. Okay, that was very interesting, that one. Thank you, Hussein. Hussein, how did you find that for yourself before we ask other people? Were you happy with that, Hussein?
Sorry?
Were you happy with that, or did you have any difficulties when you were speaking? Were you happy?
Yeah, I just got a little bit pressure in my butt.
Okay,
I think
well,
I was right, yeah.
For me, that was really good. There was one thing, but I'm going to ask Amanda first. Did you have any issues with that, Amanda, or was it mostly okay?
It was mostly okay. There was something, but I couldn't hear it properly. There was just a little something, but I can't put my finger on it because I couldn't hear properly.
I think what it was, guys, is that, did you notice that he started with thank you for, right? Then he said before, do you have any questions? That's fine. And then he said, I've just finished. It felt like repetition, was saying. It felt, you do, if you use number 1, I don't think you need number 2. Okay, guys? Because you already are giving me the context here. Thank you for letting me examine you. I have just finished examining you. It's the same thing. Okay, so it felt slightly awkward. But guys, these tiny things, they just don't matter very much. I thought that was very good overall. Okay.
They don't matter, you're right.
We set this up so we can criticize and look at every detail, but you know, these things, it doesn't really matter. As long as it's not a huge error, you can make small mistakes. You can do small little things like this. Okay, Shanice, do you want to try?
Yes, please.
Everyone listen to Shanice. 3, 2, 1, go.
Thank you for letting me examine you. Before I continue, do you have any questions, Alan?
Yes. Why is it taking so long?
Because the procedure is quite long, Alan. But thank you for your patience.
That is brilliant. Such a brilliant.
We'll call you AA, Awkward Alan. And you
No,
did really well, Shanice.
That is such a clever answer. Okay, one more time. I won't say. I assume the patients won't say yes. Okay.
Yeah,
But
I just say tendinitis, okay?
so one more time from the beginning. 3, 2, 1, go.
Thank you for letting me examine you. And before I continue, do you have any questions, Ellen?
Not really, no.
All examination findings show that you have mild tendinitis on your shoulder. And let me explain. Do you know anything about tendinitis, Ellen?
Not really.
Let me explain what it is. It's a kind of inflammation. It happens between the tendon and the bones, and I know it sounds quite serious, but it's nothing serious. And with no, no, no.
No, that's fine. So we're not. She started into her explanation, but we're not looking at that today. And I thought that was actually a good explanation. Did anyone hear any errors from her there?
Alan, just instead of saying before I continue, how about if I say before we continue, just to make friendly conversation?
Say it again before one more time.
I mean, instead of saying before I continue, something like that. How about if I say before we continue or before we proceed, just to make a friendly conversation, something like that?
Yeah, well, we already have that written down. I'm not following that exactly. But you said before we proceed, and I remember that, guys. Do you remember he said before we proceed? Is that better or worse than continue, everyone?
No, not that one. No, I'm not talking about the word. Just I'm talking about that.
I'm not saying I'm not really
I
understand. I don't understand your question. Okay, so I'm changing the topic. Before we proceed, is that better or worse, guys, than continue? Before I continue, before we proceed.
It's even.
They're both the
Better.
same. They're both the same. The same. I liked this when you did this. I really liked it. He changed the vocab. They're both good, I think. Okay.
It's like what you mean is that instead
Mario.
of I, can we use we? That's what he's trying to say. That is it I or we? That's
Is that what he's trying to say? Is that what you're saying?
That's not my question. Sorry, Alan. Just I'm talking about who did the I mean the action. So I talk about I or we. So can I, instead of saying before I continue, it is okay to say before we, just to involve the
It
patient.
makes zero difference. You can say I, you can say we. There's one person, there's two people. It doesn't matter. Yeah. Okay. So we don't need to talk about this for a long time, guys. Both of these are completely fine. Right. Now, Amanda, I don't know if you have to go. I'm planning to do 10 more minutes, but if you have any, obviously, feel free to.
Only going to bed because it's 11 o'clock, but that's
right, okay.
But I can stay. I will stay actually.
Well,
yeah.
well, no, I think it's up to you, okay, guys. But let me just finish by saying, Amanda, she's really nice. I'm probably overdoing this. I'm sorry, Amanda, but
you are not overdoing it. You're doing a brilliant job.
Honestly,
flattery. Remember,
I'm going to embarrass her. Often you get like a message to SET, and it's like really nice message. Oh, I really like SET, and then very, very often you see the name connected with that message, and it's often Amanda. Right? I really enjoyed Amanda. So if you want some one-to-one with someone who's really nice, but also knows a lot about OET, she does this every day, the speaking. She knows more than me. Check out the one-to-ones, okay? Now.
Thank you. I will go, by the way, because I've got your message, Paul.
Yeah, if it's late. Okay.
Thank you. Okay. Thank you for having me. Take care, guys.
You're very welcome.
Thank you, Amanda.
Thank you. Have a good night.
Bye-bye. Bye-bye.
She is lovely, guys. Now, nurse. This is a real one now. Okay, so obviously this one isn't. It's very generic, but this is a real nurse's card where this is happening. I'm going to give you all 1 minute, 60 seconds. Where does it say that we're starting in the middle? Just have a quick look. Put your hands up when you can see where it says exactly that we're starting the dialogue in the middle of the action. Put your hands up when you can see it, and we'll just wait. Okay, so let me just choose randomly. Fumi, where does it say, or Angela?
Yes, patient you finished that blood pressure.
You finished,
And
or
yeah,
you find?
You find the
and find
glucose levels.
yeah. Sorry, you find the blood pressure and glucose level measurement are moderately high. Yeah.
Okay.
This
So
part.
it's not always going to be you just finished. It might be
so
you're fine,
that's
right?
fine.
And look, am I taking the blood pressure here? No. So it must already have happened, right? So this is a real world example. And I hope today, guys, you can see it's not so difficult. You just say the phrase, right? And then you just try to start the card. Okay. So where is it gone? I'm going to take it here. Put your hands down, guys. Nurses, I want a nurse to try this one. A nurse who didn't already speak. So maybe Angela, if you want to try this, or any nurse. Okay. Now, let me just put this so people can see. How much time do we have in the exam, guys, to prepare before we start speaking?
3 minutes.
3 minutes.
Three, okay. So don't worry, Angela, you go first, but I think I should just give you a bit of time. Think about how do you do this? What is going inside? What are you going to say? And then how do you get it into this? You see what I mean? So I'll give you, just tell me when you're ready. Everyone else just read the cue card and wait. Okay. And Angela, just take a few moments just to make sure you're ready. I think I'm gonna do it as well. What should she say?
I mean, I need to start because I have to start the clinic. So I'm just gonna do it quickly once and
go,
give
okay?
me give me the feedback.
I will. And if you need to go, just go, yeah? And I'll do the video feedback and you can watch later, okay? Okay,
Yeah.
guys, here we go. 3, 2, 1. Angela, start when you feel ready.
Yeah, thank you for letting me do your blood pressure and measure your blood glucose levels. Before I continue, do you have any question?
No, not at all.
Okay, so I need to give you the results. My findings are that your blood pressure is slightly high and the blood glucose levels as well are a little bit high. There is nothing to worry, but we will monitor you. So we'll give you a follow-up in 2 weeks' time and we'll give you all the lifestyle advice.
Okay, great.
Do you have any question?
No.
No, I did it all together, but I probably will separate.
Well, what does she need to do? That was very, very good, Angela. What does she need to do here, guys? She needs
The
to
well-being, to ask how she's feeling.
Can I
Ask
ask
some
about
questions.
your well-being? It's a bit of a strange question to ask, okay? But you need to ask me about my well-being just at the end there, okay? But Angela, guys,
How can I ask that question, Adam?
just say this. Can I ask about your well-being? Or you could say, can I ask about your, I don't know, what's a better way? Can I ask how you are at the moment?
Feelings.
How you
How
are
are you
feeling?
feeling today?
How are you feeling today? Yeah.
How do you describe your health?
But she did this well, guys. She put a very good paraphrase in. She used Amanda's technique of, do you have any questions? Then she told me in a very polite and formal way about my results. And then she just needed to ask this question. Okay. So I thought that was a very good example. I don't have any problems with that, Angela, actually. Okay. And I know you need to go. Okay. So let's have someone else now. One more nurse who would like to try this, or even a doctor. It doesn't matter, actually, profession. Just put your hands up, okay, if you want to try it. Fatima. Okay. You want to try?
Yes, please.
Okay. 3, 2, 1, go.
Hi, Alan. Thank you for letting me check your blood pressure and your blood sugar level. Before I explain, do you have any questions?
Not really. No.
No. Okay, let me explain your recent headaches because of the increasing of your blood pressure and your medication. We're going to discuss about the doctor. Do you have any more questions about your medications?
Still no. Still no.
Still no. Okay. And can I explain your hyperglycemia?
Yeah, if you want, you can explain that.
Yeah, hyperglycemia means it's the high blood glucose in your blood. I think we need to monitor your hyperglycemia 3 times a day, morning and before you eating. We have to check your blood glucose level.
Stop there. This is very nice, Fatima. Why are you not asking about my well-being? Why did you?
Oh, I
you
forgot. Sorry.
Okay, but again, look, with Brit today, I'm not really interested in so much in the cue card, just practicing. Again, did anyone hear any serious problems with this? What did it go well? She paraphrased well. I don't think there was actually any problem. She just like Angela, she forgot to ask this question at the end. But I thought it was okay. I didn't have any feelings of like, oh, this is not right. I thought it was very good, actually. Did anyone hear anything though that they didn't like?
Excuse me. What
How you
I
doing?
hear about the hyperglycemia that she continues to mention is
Yeah.
like a medical jargon that patients will not understand and may feel anxious or
Okay.
concerned about the way she says it.
That's my only problem. Like, firstly, why did you try to explain it? There's nothing here about that. And also, she is right. You need to be maybe trying to just be a bit careful with technical language because OET can.
Like simple words like blood glucose level, I probably understand a bit better.
Yeah. So this is something I think, Fatima, do you agree? Just be careful, everyone, in
Yeah.
your exam. If you have any doubt about, I mean, look at hyperglycemia, right? Lots of people will know what that is, but some won't. So try to simplify the language to avoid losing any marks. In OET, if I say, for example, myocardial infarction, you're going to lose marks because no patient will understand what that is. You have to say it in a simple way, heart attack, something like that. Okay. So I think I'm going to do one more and then we'll finish for today. Tomorrow we'll be back and I'm just going to continue with this, but tomorrow it'll just be all introductions. Okay. So if you want to practice your introduction, I strongly recommend if you're watching the video or if you are here now and you want me to give personal opinion on your introduction, come tomorrow and everyone in the class can perform an introduction. Is that clear, everyone? I think.
Yeah, thank you.
Now, do you all have the diagram that I made? It's in the chat. Does everyone have that diagram? I'll put it here again. Look. If anyone is worried about this, in the diagram, I'll put this on the video as well. Just practice that. You have a script. Memorize it. Just learn it. Okay? Come tomorrow and hopefully we'll have some really good examples of people doing this. All types. Start in the middle or known, unknown, hospital, home, everything like this. Are there any pharmacists here today? Who's a pharmacist?
Yeah, I am.
So Svetlana, as well, you can practice a pharmacy one tomorrow with me, okay?
Okay.
If you want. So guys, if you're in a pharmacy, it's a bit different because it's like a shop. So you can't it's slightly different, but we'll see some examples tomorrow from Svetlana.
Okay, thank you, Alan.
I think probably I'll stop here, okay? Actually, do we have a physiotherapist here? Is there a physiotherapist in the class? Just last one. If we don't, then I'll finish.
Let me ask you a small question, please, Alan. About well-being. Could you give me an example of question about well-being? I don't understand. How can we check that?
Well-being is just happiness. Okay, so if you think about just ask how they're feeling.
Oh, how are you feeling at the moment?
Yeah, it was confusing me as well. I felt confused, but basically it's how you're feeling. Okay.
Many thanks.
Anyone want to try this? Last one? Anyone who's not spoken yet, just before we finish? Oh, who's brave here? Who put their hand up? Someone who's not spoken yet, if that's okay, though. Yevgeny, Hussein, you've both done this. I'll choose one of you, but is there one person here who didn't try yet? You've got the language. You've seen many examples. Ayadola, do you want to try? You've been some really good observations today. Anyone?
Yes, I'll just have to read it.
Okay, we're going to finish with one final performance from Ayadola. She's not a physio, but it doesn't matter. Okay.
Just
okay.
Okay.
So, guys, last one. Everyone, listen to this. 3, 2, 1. Start when you feel ready.
I've just examined the knee injury of your knee injury, and do you have any question before I find out the details about the injury from you?
No.
All right. Now I want to let's go and find out the details about the injury. Do you have any pain, or do you have any pain when do you normally have pain? Was it in the morning or in the evening?
Okay, interesting one. Okay, so stop there. Ayadola. You did.
I started with close question.
So you asked about 10 questions about pain. Look, actually, she's not a physio. I didn't give her much preparation time. Okay, so if you give her a chance, she did use the phrase, right? I have just. She used it. Then she used Amanda's technique correctly. I thought, what's this? Did anyone notice she said, now let's go to the details? What was she doing? Anyone? Now let's discuss the details. Signpost, right? So she put a signpost in. She was starting the card, and then she asked me probably too many questions about pain. What did she need to ask for pain? Just, do you have any pain? Right? That's it.
Yes.
And then wait. So there was some fluency issues. She was starting and stopping a little bit, but actually she did she did 4 really good things. Okay, so all you need to do, Ayadola, is just practice a bit more.
Practice, yeah.
But I thought that was actually really good. I like to have examples where guys, it doesn't have to be perfect. The most important thing is that you actually do the things that OET are looking for, right? OET are looking for signposts. She did a signpost. OET are looking for an introduction that is appropriate. That means the correct introduction. Well, it was starting in the middle and she started in the correct way. She didn't try to get names. Okay. Anyway, I'll finish for today. Thanks very much, guys. I'll see you all later on, and thanks for your time. Guys, have a nice lunch.
Thank you, Alan.